This is a presentation on Iron Deficiency Anemia by Jennifer Fleming and Alexandria Trigiani for Biology 273. Iron deficiency anemia is a process in the cardiovascular system where hemoglobin in the blood is very low. Let's take a look at a healthy blood vessel. Here you see a healthy blood vessel with some red blood cells circulating inside. Red blood cells have a biconcave shape and circulate inside the body for about 120 days before being broken down. A normal red blood cell contains a protein called hemoglobin, which binds to oxygen molecules brought into the body through the respiratory system. Hemoglobin transports the oxygen throughout the body and delivers it to the tissues that require it. This is an extremely important process since nearly every cell in the body requires oxygen to perform its function. Let's take a look at what the same process looks like in someone who has iron deficiency anemia. Iron is important for the development of healthy red blood cells. If your body begins to lack iron, not enough red blood cells will be produced. To further the problem, the red blood cells a body does produce will have fewer hemoglobin proteins than in a normal red blood cell. Fewer hemoglobin proteins means less oxygen being transported around the body. Iron deficiency anemia can be caused by insufficient intake or absorption of iron or loss of iron through bleeding. Symptoms of iron deficiency anemia include fatigue, shortness of breath, restless leg syndrome, pica, which is an eating disorder where someone persistently eats things that hold no nutritional value, things like dirt or paint, also brittle nails, and blue sclera, which is the decoloration of the eyes that gives them a blue-gray color. This is due to veins showing through a thin sclera. The prevalence rate is 2% for adult men and 9 to 12% for adult women. Women show a higher prevalence rate due to things such as menstrual bleeding, which can be a large source of iron loss for women. High dietary sources of iron include beans, poultry, dark green leafy vegetables, seafood, and red meat. You can imagine having a lack of access to these kinds of foods would have an impact on one person's iron intake. Iron deficiency anemia affects a lot of people worldwide, but luckily prognosis is good for most people where healthcare is available. This is due in part to the availability of easy treatments, which we will discuss next. Although prognosis is good, some studies have found that behavioral and developmental outcomes may be lower for those who have had severe anemia since childhood, despite treatment. Regarding treatments for iron deficiency anemia, the first option tried is usually oral iron supplements. The absorption of the iron is facilitated by also taking a form of vitamin C at the same time. Blood transfusions are another option for those who do not respond well to the oral supplements. Thank you for listening to our presentation on iron deficiency anemia. I hope it's helped you to learn more about the pathophysiology of this chronic disease.